In the next couple of minutes, we will go over some national statistics about common mental health disorders in the United States. Mental health disorders are common. 1 in 5 teens lives with a mental health condition, and that's only counting the ones who have been diagnosed, so we know this number is an underestimate. A large U.S. study of those who have been diagnosed with a mental health condition found that it takes an average of 10 years from the time a person had their first sign or symptom of a mental health illness to when they first get treatment. Attention deficit hyperactivity disorder, behavior problems such as oppositional defiant disorder, anxiety, and depression are the most commonly diagnosed mental health disorders in teens. 9.4% of children ages 2 to 17, which is approximately 6.1 million youth, have received an ADHD diagnosis. Among young people ages 3 to 17 years, 7.4% have a diagnosed behavior problem, and 7.1% have diagnosed anxiety. 3.2% of children in that same age group, which is approximately 1.9 million, have diagnosed depression. The rate of mental health disorders changes with age. For example, diagnoses of depression and anxiety are more common with increased age due to higher stress levels and hormonal changes. Behavior problems are more common among children ages 6 to 11 years than in younger or older youth. Adolescence is a time when many mental health disorders begin. In fact, half of all lifetime cases of mental illness begin by age 14. 3/4 of cases of mental illness begin by age 24. And the median age of onset for anxiety, eating disorders, schizophrenia, and substance use disorders all typically begin before age 24. Another striking statistic is that suicide is the third leading cause of death for young people ages 15 to 24 years. The first and second are accidents and homicides. Early mental health support can help youth before problems interfere with other developmental needs. However, studies have shown that the majority of youth with major depression do not receive any mental health treatment. Reasons for this can include limited access to mental health professionals, the cost of treatment, the stigma on seeking help, or lack of awareness. Why is it important to intervene early in a person's mental health disorder or illness? So we can change the trajectory of a young person's life. Again, early mental health support can help a child before problems interfere with other developmental needs. If youth get the help they need before problems become severe, there's more chance for recovery. If youth don't get the help they need, it's much harder for them to get better. Recovery refers to the process in which people are able to live, work, learn, and participate fully in their communities. Studies show that many people with mental health disorders recover. Just because someone receives mental health treatment doesn't mean that they will need professional help the rest of their lives. This is why we believe it's so important for you and all adults to learn about mental health. If we listen, talk to youth, and support them, we can make an impact. Any adult, you can make a difference in a young person's life.